Over 70% of recurrent early miscarriages happen due to a history of induced abortions. So patients with recurrent miscarriages have a history of induced abortions in their past. And why induced abortion is so dangerous is because not only does it harm the uterus lining during the scraping of the uterus lining, trying to remove the embryo or fetus, it damages the surrounding of the uterus. Furthermore, it also introduces the fetal tissue or embryonic tissue into the mother's system, because when the scraping is done, there's a bleeding on the uterine wall and exposing some veins underneath, which allows all these embryonic tissues or fetal tissues to enter into the mother's bloodstream. This process will trigger an immune response. The mother will generate specific antibodies towards her next pregnancy, which is why she will have recurrent miscarriages over and over again because of induced abortions alone. So here at Antai Hospital, we are against using induced abortions using the methods such as dilation or curettage, which is the more common one, vacuum aspiration, and so on. All of these methods are very damaging to both the mother and her future pregnancies. We recommend using hysteroscopy to do a proper and safe induced abortion. How hysteroscopy works is that hysteroscopy is basically a surgery using a hysteroscope. A hysteroscope is basically an endoscope attached with a light source, a camera, surgical clippers, scissors, and other tools. And it accurately goes into the uterine cavity via the dilated cervix. And the biggest advantage that hysteroscopy offers is direct visualization. This means the surgeon has direct and clear view of the fetus or the embryo that he wants to acquire and remove. So he can carefully use the tools that he has provided with his hysteroscope, for example, clippers and scissors, to accurately and completely remove the fetal tissues without causing any harm or any damages to the mother's uterus. So this significantly lowers the chances of any potential fetal tissue going into the mother's body, affecting her future pregnancies. Furthermore, because of how careful and precise this procedure is, little to no harm is done to the mother's uterus lining. So there are no side effects, no bleeding, and no intrauterine adhesions that might form after the induced abortion. No matter how early the pregnancy is, no matter how small the embryo is, hysteroscopy can accurately identify it, and with the camera and the light source, our surgeons can still accurately acquire it without causing any harm and without causing it to shatter. Once acquired, right, we can even do further analysis of the acquired embryo and fetal tissue and do some study to find out what is the cause of miscarriage. For example, it could be due to fetal chromosomal instability or abnormality, or maybe it could be a nutritional deficiency. All of this because of how hysteroscopy accurately and wholly removes the pregnancy tissue. It allows us to do further analysis in the lab. So although the treatment cost for hysteroscopy is much more higher, which is why it is not really recommended in mainstream, and DNC and vacuum aspiration or abortion pills are much more common because they are of lower cost and similar results. But as we know, they do cause severe side effects and also affects her future pregnancy. So for the sake of the mother, her uterus, and also her future pregnancies, hysteroscopy has to be the golden standard for induced abortions. If you'd like to find out more details about how hysteroscopy is used for induced abortion, please refer to the article with the link in the description box below. If you have any questions, please leave them in the comments below.